New South Wales has been dealing with cases surging through the thousands in this outbreak that's been going on for 10 weeks now, with the Premier saying we just have to learn how to live with the virus. It was only a few weeks ago Victoria was celebrating seeing off Delta for a second time, but now once again it's on a knife's edge and the numbers today are challenging once again. Victoria has recorded 50 locally acquired COVID cases in the past day. Before we go to our reporter, a quick look at the numbers. So we're now adding a yellow portion to the bars for Victoria. We've only done the last 3 days at this stage. That's the number of cases that were in the community while infectious, and you can see while the number has come down today to fit the total number of case numbers down to 50, continuing concern over that number who were in the community while infectious. Reporter Eden Hennanen joins us now from Melbourne. Eden, g'day. So take us through today's figures.
Yeah, good afternoon, Joe. As you just mentioned, good morning, Joe, I should say. As you just mentioned, Victoria has recorded 50 new locally acquired cases over the past 24 hours. And like you said, that headline number is down from yesterday's 71 cases, but it is those mystery cases and those that were in isolation during their infectious period. As you just mentioned, only 11 cases of those 50 cases were in isolation during their infectious period. So I think that's why we're seeing wider areas of concern. There are 660 exposure sites across the state, and that comes, like I said, yesterday's 71 cases. And health authorities say that if these mystery cases and those small numbers in quarantine continue over the next few weeks, we may in fact see those numbers rise in the coming days or weeks, Joe.
And what's happening with the vaccination rates there in Victoria?
Well, we've been hearing all morning Australia-wide and in recent weeks about the push for vaccination rates to increase Australia-wide. So it came as quite a surprise yesterday to health authorities when they were saying that 10,000 Victorians a day are either not turning up to vaccination hubs or cancelling their vaccine. And that's 10,000 a day. And this is due to the possibility of the Pfizer vaccine being rolled out further next month and the eligibility being widened across the state. But I did visit a new vaccination hub, drive-through vaccination hub in Broadmeadows yesterday, and I must say I was a little surprised to see not as many cars coming in as I would expect. So the state government is really urging Victorians not to cancel their appointments and be part of this big blitz to get Victorians vaccinated.
And when does this period of lockdown, when is that scheduled to end in Victoria?
So we heard in recent days, regional Victoria did join Melbourne in the widespread lockdown that was due to end September 2nd. But Joe, as you just mentioned earlier, the number of cases that we're seeing, the number of mystery cases, and just repeating today, 11 of those cases, 50 cases were in quarantine during their infectious period. That's seeing many out in the community while infectious. Like I said before, there's 660 exposure sites now across the state. We're hearing overnight that there's new ones, Tier 1s added in Melbourne's north, in Pascoe, Brunswick, Craigieburn, and also in Melbourne's southeast in the Mornington Peninsula and in Sorrento area. So this has many speculating whether we will end up reopening on September 2nd, but we've been hearing a lot of reports. Melbourne epidemiologist Tony Blakely has open discussions about the idea of a soft lockdown being introduced and the fact that maybe we won't go down to 0 cases before we open back up. Now, we've been hearing about that from the New South Wales Premier as well as the Doherty Institute about reopening the states despite numbers increasing. So it'd be interesting to see how that pans out, Joe.
Okay, Eden Hennanen reporting there from Melbourne. And no doubt there'll be a lot of Victorians keen on listening into that media conference today, which will generally happen sometime between 11 and 12. We'll be juggling those media conferences for you from New South Wales, the ACT and Victoria. We'll bring them to you in some form and we'll keep you across that, how we're going to do that through the day. Let's head to New South Wales now. It's about to hit a milestone in the fight against the Delta variant of COVID. It'll register its 6th millionth injection. But the number of COVID cases remains stubbornly high. New South Wales recorded 818 locally acquired infections yesterday and 3 more deaths. at least 57 cases. So that's a yellow portion of these bars. 57 were confirmed to have been infectious in the community. But that massive portion of that bar, that red figure there, where authorities just hadn't determined the isolation status of those cases at the end of the day, continues to indicate just how big the challenge is in New South Wales. Reporter Lara Himes joins us now from Sydney. Lara, g'day. So let's start with some promising news because, yeah, it can be a bit overwhelming when we talk about just how many cases there have been in New South Wales over the past 10 weeks. What is promising about what we're hearing today?
Well, it's long been a goal of the New South Wales state government that we get to those 6 million vaccines by the end of August. Now, it seems that we may have reached that target in the last 24 hours, albeit a week early. Now, when you translate that into the population statistics, it appears that about 59% of people in New South Wales have now had their first dose and about 30% have had that double dose. So whilst we have reached that target for now, obviously the message is still to keep up those vaccination rates and also ensuring those people become double dosed. We have heard from the New South Wales government that we could see some greater freedoms once we reach that target. Now, it hasn't exactly been outlined what that would be or what that would look like, or whether or not the implementation of that would be once we reach that target of 6 million, or by the date that was part of the original goal-setting objective. We know that these COVID cases have put enormous pressure on the healthcare system, especially in hospitals. We have seen ramping occurred during this particular outbreak, and we know that there have been outbreaks within particular wards of that too. We have heard from some of the specialists at the ICU units. This morning we heard from a specialist at Nepean Hospital who said that they are expecting cases to rise.
We've been bracing for, as you know, the embracing for the surge, and we've been doing that now for the 18 months. There's no doubt the system does come under strain, but we have had, we remain vigilant, and our staff remain committed to providing excellent care and compassionate care.
And so, Lara, the people of Greater Sydney have been in lockdown now for 8.5 weeks. That's a lot of time for parents to have been at home with their kids, homeschooling them, and in regional New South Wales for a bit of a shorter period than 8.5 weeks, but also dealing with the same challenges. What is likely to happen with schools over the coming months?
Well, there's been a question on every working from home parent's mind. It's constantly been put forward to the Premier about when we can see schools resuming their face-to-face learning capabilities. Now, we did hear from the Chief Health Officer, Dr. Kerry Chant, when she fronted an estimates committee yesterday. There's still some indicators and some objectives that need to be overcome before that discussion can continue and a firm determination can be made. We do need to see high vaccination rates among students, so particularly around that 16 to 19-year-old cohort. At the moment, the vaccination rates for that particular group stands at about 14%. We also need to have the vaccination rate of adults continue to increase, and we do need to see those case numbers come down. Now, for the past 3 days, we have seen New South Wales record more than 800 cases a day, so that is still remaining quite high, but it won't be until some of those objectives are met that we can get a firmer picture of when school is going to resume.
Okay, Lara Himes reporting there from Sydney. Let's head to the ACT now. There were 16 new locally acquired infections yesterday. 3 were in the community during their infectious period. That's shown in, we're just adding that for the ACT bar graphs. Now we'll fill in the other bars over the next 24 hours or so. But the day before there were no cases infectious in the community. So the situation's looking relatively promising there in the ACT. Reporter Holly Tregenza joins us now from Canberra. Holly, g'day. The challenges facing New South Wales and Victoria are pretty. It's looking pretty tough. But are the people in the ACT feeling pretty optimistic about how things are going there?
Yeah, g'day Joe. That's exactly right. As you said, 16 new cases yesterday. That makes our total of active cases in the ACT at the moment at 137. But 13 of those have already been linked to known clusters. So as you said, we have been doing really well, particularly the last few days. One of concern yesterday, one of the active cases is part of the disability sector cluster that we've seen here in Canberra. That builds that cluster to 15 people. We also saw a number of new exposure sites come through overnight, 21, and that makes it almost 400 exposure sites across the territory. There are obviously going to be people going into quarantine today after that news, but there are also a lot of people coming out of quarantine over the next few days. The ACT government is expecting a big increase in the number of people getting tested as people from a number of schools that were exposure sites finish their 14-day quarantine period, go on to get tested, and then we'll be able to go and come out of quarantine, Joe.
And Holly, when we were chatting to one of the Canberra reporters there in the last couple of days when this first started, she was talking about the Canberrans being a pretty obedient bunch. Have a feature of the media conferences that we've heard in New South Wales and Victoria have been frustration that people have been doing the wrong things. As you've been listening into those ACT updates each day, does that happen much with people alleged to have been doing the wrong thing, or have people, the authorities there just don't have many examples of that at all?
Well, it's funny that you asked that, Joe. I would say that we're fairly obedient. I did see a comment on Twitter that perhaps that's because we are among one of the wealthiest places in the country, and we are also highly educated. So there's things going for this population. Around 40% of the workers here are in the public service, and that means that they can really easily switch to work from home. So yes, we are quite obedient, and we have had not many people getting fines, although there was people that were actually lost out in the bush the other day. They had to get rescued, and then of course they got fined because they weren't meant to be there. So, but by and large, yes, we have had seen a lot of compliance across the territory, and even before this, there were people wearing masks in busy shops and supermarkets and shopping centres when they didn't have to. So people certainly compliant, yeah.
And, okay, Holly, and finally, what's happening with vaccinations there in the territory?
Yeah, so yesterday the government announced that people aged 16 to 29 would be able to register for a vaccination. At this stage, it looks like they probably won't be able to get those injections until about October when we get the supply. But there is obviously a real desire to have it. Overnight, there are about 9,000 people that registered in that age bracket for these vaccines. And the Chief Minister, Andrew Barr, has been fairly scathing about the federal government's rollout of the vaccine and of supply. But yesterday, his call out was actually for older Canberrans, for those people who are already eligible to come forward to get vaccinated and to buy time for younger people who will have to wait for their vaccination.
Okay, cheers, Holly. Holly Tregenza reporting there. The scientists behind the government's pandemic modelling have intervened in the increasingly fractious debate about Australia's COVID exit strategy. Some leaders are worried about the plan to ease restrictions once 70% of adults have been vaccinated because of the Delta outbreak in New South Wales. But the Doherty Institute says the states and territories can safely reopen with that level of vaccine coverage, regardless of COVID case numbers, or if they were in the hundreds. Political reporter Jane Norman joins us now from Parliament House in Canberra. Jane, g'day. So how confident is the Prime Minister that this national plan will be followed?
Yeah, well, the PM reckons, or is pretty confident, that the states and territories will end up following this plan. Just for context, we're at about 30% vaccine coverage right now for over 16. So we have a few months to go before we reach that all-important 70% threshold. And I think that is why we're starting to have this conversation now to prepare Australians with the life of living with COVID-19. But certainly in recent days, we have seen some hesitancy from the more risk-averse states like Western Australia and Queensland to to a lesser extent. They've pointed out that the plan, these vaccine thresholds, was modelled on the assumption that when Australia hit that 70% threshold, that there'd only be about 30 COVID cases in the community. Well, we're still a few months away, but I think looking at how New South Wales and Victoria are going, it's likely that when we do achieve that target, there'll still be hundreds of COVID cases in the community. So that is why some premiers are sort of sounding the alarm. But the Doherty Institute has overnight released a really detailed and clear statement that I encourage all of our viewers to read. And their view is that Australia can safely reopen. It can safely start to ease restrictions once we hit that 70% vaccine coverage, even if there are still hundreds of cases in the community. But the Institute says the states and territories will need to maintain what it's describing as vigilant public health interventions to ensure that the death rate remains low, to ensure that hospitalisation rate remains low. So those kind of interventions are things like testing and tracing, isolation, quarantine, things that we're doing right now. But what it won't involve is the use of stringent, harsh lockdowns, the type that we are seeing right now. And this is how the Prime Minister, Scott Morrison, sort of characterised that.
We're still going to have to live sensibly in a COVID world. I mean, there's not zero restrictions. There's common sense, a baseline sort of level restrictions. And I wouldn't even call them restrictions. It's just common sense behaviour about washing your hands and maintaining good hygiene and doing all that sort of common sense stuff.
And Jane, what does the Doherty Institute have to say about the prospect of ever getting back to zero COVID cases in Australia?
It basically says that just won't happen. You can just look around the world to see that few, if any, countries have managed to totally eliminate the virus and maintain an elimination of the virus. The statement from the Doherty Institute says that COVID will not go away, but it will be easier to control in the future through the use of vaccines, which have been proven to reduce a person's chance of developing a severe illness or dying from COVID-19. So the view of the Doherty Institute and other epidemiologists is that we need to start moving towards a future where we live with COVID-19 rather than fearing COVID-19. This sort of updated advice will all be provided to National Cabinet this week for the state and territory leaders to talk about. But certainly the other lesson that Doherty points out is that we don't want to go down the same path as the UK, which had its big Freedom Day, where on one day all COVID restrictions were removed. The advice is that Australia should gradually ease restrictions once we hit those vaccine thresholds of 70 and 80%, and that ultimately, as the PM was saying, some public health measures will be maintained.
OK, Jane Norman there in Canberra. Our reporter Robin Heron joins us from Dubbo in the state's Central West. Robin, g'day. So Dubbo remains the centre of the outbreak in Western New South Wales. What can you tell us?
Morning, Joe. Yeah, at the moment we've got 283 cases in the Western Local Health District. 234 of those are in Dubbo. More than 40% of those are cases under the age of 20. So young people really being affected by this outbreak. But we do also have cases in other locations, Mudgee, Parkes, Orange, Coonamble Shire and alarmingly Gadooga, where there are 6 cases, and that's a very high Aboriginal population in that part of New South Wales, so there's concerns there. We also know in the Far West District more cases in Wilcannia. I think 7 will be included in today's official figures.
And so how are health services coping out there?
Yeah, we've been told that the Western Local Health District is now putting into plan some action plans that they've actually been making over the last 18 months, that if there was an outbreak in Western New South Wales, how they would cope with it. They're turning the Narromine Health Service, which is a facility with about 12 beds, we understand, into a COVID-only hospital, because I think most serious health cases from the Narromine District would come to Dubbo anyway. So that's going to be a COVID-only hospital. They're expanding the footprint of the Bathurst Emergency Department into like a neighbouring clinic, and they're also looking at using Dubbo's paediatric ward to accommodate young people with COVID or who are deemed close contacts of a COVID case that need accommodation.
And what's the current focus for the health response?
It's definitely testing. We know that there have been virus fragments found in quite a few locations in the region, including Lithgow, Cobar, Coonamble. We understand that they want more people testing in Orange, Bathurst and Parkes districts. In the last reporting period, that 24 hours, there were 6,000 tests, and the local health district says that's simply not good enough. It's less than half of where they would like to be. So the push is very much get tested and, of course, still get vaccinated. Those vaccination hubs are operating in a number of Western communities now.
Okay, Robin Heron reporting there from Dubbo in the central west of New South Wales.